I just gotta show everybody. And then we get to do that. Okay, we'll do the first one. It's gonna be the training that caregivers get when they're working with Alzheimer's and dementia patients. According to Alzheimer's News Today, around 1 in 4 people get diagnosed with Alzheimer's disease. This means that out of the 6 of us, or 6, 7, 8 of us here today, 1 or possibly 2 people could be diagnosed with Alzheimer's when the time comes. We all hope that nurses or caregivers caring for us have the proper training to help us. Caregivers and CNAs who work in nursing homes receive all types of training specifically towards Alzheimer's and dementia, so they're able to provide the best care possible. In this speech, you will learn the basic training that caregivers receive when they first get a nursing home job, as well as the extra training they get when they are encountering Alzheimer's or dementia. In the basic training, you learn about if you have to help someone, feed someone, the best way to help them or encourage them to feed themselves. You learn basic hygiene care, doing peri-care, which is basically giving them bed baths, helping them dress to make them still feel independent like they are doing it themselves, but helping them. And how to document things like what they do throughout their day. If you see any rashes or anything that you encounter on their body that isn't what's normally there. You learn about meal prepping. Even if you're not working in the kitchen, you still learn, everyone has a different diet that they have to follow, like if they have diabetes or can't have like milk and lactose and that kind of thing. You'll also learn communication skills. You learn how to effectively communicate with seniors from different generations. Obviously, you're not going to go telling them all about your cell phone because they aren't going to have a clue what you're talking about. But it's better to ask them. They do love reminiscing most of the time. Ask them, about when TV first came out. I've had plenty of conversations about black and white TV shows, thanks to Grandpa Joe and all his 900 videos. I've seen them all. You learn how to transport them. Some people use walkers, some are stuck in wheelchairs. You learn how to transfer them from the bed to their chair, or from their chair to a shower, or to go to the bathroom. You learn all sorts of emergency procedures, like if there's a fire drill, you have to learn how to get everyone out properly without scaring them or frightening them more than they already probably are. You have to learn how to maintain a clean, safe, and healthy environment for them and for yourselves. The biggest thing is proper hand washing. You touch pretty much anything, you wash your hands after. You use hand sanitizer continuously when you go from one residence room to another. There are a lot of workshops and seminars that you can attend. I looked up some here in Wisconsin, and there's some that are the basics, learning about memory loss, dementia, and Alzheimer's disease. You can learn about the risk factors, research, treatments, and steps to proper diagnosis and assessment. Another thing is, before you take the basics or after you take the basics, they suggest that you attend the one that is 10 warning signs of Alzheimer's, which helps you identify what's just aging and what is actual Alzheimer's signs. They also have one that you can go to about healthy living for your brain and your body, having proper nutrition. Obviously, when you have Alzheimer's or dementia, there's a lot of forgetting to eat or not eating the proper thing because you forget what you've already eaten. That's a good thing about nursing homes, is the nurses keep track of it for the patients. Another thing you really learn is how to take care of yourselves as a caregiver. You have to learn how to not overwork yourself, because yes, it is a very demanding job to care for someone who has Alzheimer's or dementia. It is really hard in a nursing home when all of the patients have Alzheimer's or dementia at some level or another. You have to learn how to, have your own proper hygiene, how to care for your own first aid, like if you have a cut in your hand, not to, not wash your hands or wear a Band-Aid and gloves. They also suggest learning to take a break for yourself. Obviously it's hard when you have kids, but if you just go home and sit 10 minutes by yourself and relax and try to wash away some of the stress of what you've dealt with while at work that day. Or mine was always riding in the car all the way back home. I would turn my music up or whatever and just relax on my way home. In conclusion, in order to provide the best care for patients, always take care of yourself and be sure to get all provided training at your job. Be sure to take the time to attend seminars and workshops. I know most facilities, nursing homes, hospitals, what have you, will either pay for you to go to the training if they want you to go, or would at least give you the time off to attend a seminar if it's to further your education. And to thank the caregivers that you encounter who provide the best possible care for your loved ones.